Doctor, can you explain how our dental health affects so many other things? I don't think many people make that connection, that there is a connection between that and other diseases, and in particular cancer. How is that possible?
It's actually a very important and overlooked topic, which is being more paid attention to in Europe than in the United States, but it's slowly changing. There are really two kinds of dentistry. There is regular dentistry that looks at the teeth as tools for eating, and if there is a problem, we fix the hole or whatever it is. And there's really a field called biological dentistry or holistic dentistry that looks at the relationship between the teeth and the whole body, our whole health. In general, the TMJ, the temporomandibular joint, the one that we chew with, and our bones, the upper jaw, the lower jaw, this is the most frequently used joint in the body. And it works under great pressure all the time, for talking, for eating, for drinking, etc. What we find out that there are a lot of issues that relate to bone health, that relate to dental health, that relate to gum health, that can affect not only the localized area, but can affect our whole well-being. And there are a few areas that are very important. One area that is more and more recognized is just the idea of using amalgam fillings. Amalgam have about 50% mercury. And it just doesn't make sense to put one of the most toxic material on earth in the mouth of somebody. And there have been studies showing that, that there is a leakage from mercury fillings into the system. Very interesting animal studies where they took mice, and when the mother had amalgam fillings, the immune system of the offspring was suppressed, and when they removed the amalgam fillings, the immune system became better. So there is pretty solid evidence about the issue of mercury leakage and mercury toxicity with dental issues. Also, very often under amalgam fillings, some dentists say almost always when you actually change the filling, there is decay. There is a subtle subclinical infection. So these are very serious issues. In the industry, the dental industry, if they admitted wrongdoing when it came to amalgam fillings, it would be the biggest lawsuit ever. So they are slowly moving away from amalgam fillings due to quote-unquote cosmetic reasons. So that's one issue. It becomes worse when you have a few different metals in the mouth. If you have amalgam, silver fillings, and then you have some gold, there is, because of the different metals, you can get a current, an electric current between the fillings, which can affect our health. And there's a way to actually measure it. So this is talking about amalgam fillings. But there are much bigger issues. And one of the bigger issues is the issue of root canals. The roots is what holds the teeth in place. There are some teeth have one root, some teeth have double roots, and in different places. And often when there's a problem, deep, within the tooth with a very deep cavity, the root has to be replaced, and a titanium post, is placed. Sometimes other metals are used. This is traditionally. And they almost universally get infected. Almost every root canal is infected. The problem, Scott, is that very often it's subclinical. The patient doesn't know about it. So in the past, it was very much voodoo medicine, this idea that root canals are infected, and also when you take out the wisdom teeth or you extract other teeth, often the cavity is not cleaned enough. You don't scrape the bone that was infected if the tooth had an infection. And it's something called a cavitation, a very subtle infection that stays in the bone, chronic myelitis of the bone, which is other part of the body, is actually a medical emergency. You go to the ER, you get IV antibiotics, etc. Well, now with technology, it's no longer myth. We can use an imaging called cone beam, which is very similar to a CT scan, but much less radiation. And suddenly, whoops, we see infections in the bones, very often without any clinical symptoms. So all these ideas that before we were measuring with current and with different German, testing and muscle testing, etc. Now we have an imaging. Now it's medically acceptable. And suddenly we are realizing so many patients actually have chronic infection of their jaw. Not only of the tooth, but of the jaw. And I mean, there's some remarkable stories that I can tell, and maybe I'll tell it a little bit later once I go a little bit in greater detail into the issue. So that's one area, very big area. The other area that we know that gum health relates to cardiovascular health. People with poor gum health, with a lot of gum bleeding and infection and receding gums, have a greater incidences of heart attacks and heart disease. This is actually acceptable even in Western medicine. So we talk now about the idea of the root canals, the worst issue, the amalgam filling that we can eliminate, we can avoid, and the gum health, the gum disease. But a very important component is the topography of the teeth. Just like we have different diagnostic methods, face diagnosis, reflexology with diagnosis from the foot, pulse diagnosis, ear diagnosis, also every tooth relates to a different organ. And it has some very simple sense. The middle teeth, the front teeth, relate to organs in the midline of the body, because it's in the middle line. As we go to the side, it relates to more organs that are on the sides of the body. So over the years, there are very detailed maps that have been confirmed again and again, where you can see relationship between the tooth and a certain organ. Very often, I can't tell you how often I see it, it's remarkable, you will see issues with root canal or infected tooth or bone in the tooth that relate to a specific cancer. For example, I had a patient with an aggressive breast cancer of the left chest that reoccurred again and again. And I think it was tooth 14, if I remember if I remember my numbers correct, that was related to the left breast. When we did the cone beam, there was no more bone left. The tooth was hanging on the gums. The bone was eaten up completely with infection for years, and the patient didn't know. Now this patient will get treatment chemotherapy, and the cancer will reoccur again in the chest wall, again and again. When we removed the tooth that was completely gone, and we cleaned the area, which means it's a referral to a special dentist, the same patient responded much better to the same chemotherapy. I have many stories about patients with cancer who had one patient who had uterine cancer, and after the surgery, the place did not heal. And she had abscess again and again, and antibiotic, nothing helped. She was found to have a huge abscess in one of her frontal teeth that related to the uterine area. When the tooth was removed, immediately the abscess, it resolved immediately within days. And I'm just giving you two out of many examples. So the first thing is awareness. Many doctors don't ask about dental health. At Amitabha Clinic, we always ask about dental health. And if we have any suspicion, we send patients we send them to a cone beam imaging, and then they see an oral surgeon that is trained and works closely with us that can analyze it. Now, what to do? One of the big questions is, what can you do if you have a problem? There are a few levels of therapy. Sometimes the worst issue is the issue of root canals and cavitations. And if you have a root canal, especially if it's on the tooth that relates to your cancer, the best thing is to take the tooth out. And if you have all your other teeth in place, it's not a problem. You just do a bridge and you can eat, there's no issue. Sometimes if the patient is very weak or there are multiple teeth, there are some dentists who inject ozone into the dental cavity. It also penetrates into the sinuses a little bit. And the ozone will sterilize the area. It's a temporary issue, but it will decrease or eliminate the infection and will give a relief to the patient. The worst issues are with root canals that are at the upper jaw, because then they penetrate into the sinuses, they cause chronic sinus infections and a lot of other problems. And I had so many patients with sinus infections. At the moment the tooth is taken out, sinus infection is gone. So in the upper jaw, it is best to take out the teeth and do a bridge. Implants are a solution, but however, most implants are titanium implants. And many people are allergic to titanium. We underestimate it. There's a new inert substance called zirconium, which just got approved last fall in the United States. It has been approved in Europe for many years. And it's a much safer substance to actually use as a post for your root canals. It's safer to do implants at the bottom jaw because you don't have the issue of going into the sinuses and affecting the brain. But it's better to have an implant than to have an infected root canal. There is no doubt about it. So we have to really address the issue of root canals. But dental and oral hygiene is very important. Flossing 2-3 times a day, brushing your teeth well, taking care of your gum health, very, very important, extremely important. There's also another phenomena where you have dead tooth. The tooth is still there, but it's not alive anymore. And you can see it gets a discoloration, becomes browner or yellow or a different color. And usually it's not alive. One simple solution is to take it out because it's not good to leave a dead organ in its place. It drains the energy from the body, especially from the certain channel or organ. Another thing, there are some dentists who use trays and they use nattokinase, which is actually a gel that thins the blood and improves circulation, and sometimes we can revitalize and wake up the tooth. An interesting formula, a Tibetan-based formula, called Pedma Basic, was studied in 52 cases of documented root canal issues, infection, based on imaging and symptoms. And in almost all of them, within 3 to 4 days, symptoms subsided and the root canal issue resolved. So it's the only really herbal formula that was shown to have an effect on root canals. And definitely I recommend for anybody with root canal issues to take it because it thins the blood, improves circulation, it regulates the inflammatory process, it enhances the immune system. So this is what you can do. You can use some supplement. I gave an example, an oral supplement using a tray. You can use ozone. You want to get rid of your amalgam fillings. When you want to get rid of your amalgam fillings, make sure to use a dentist that knows how to do it. You need to get oxygen. Your mouth needs to be completely covered so you don't swallow the amalgam, which is much worse. Better to be in the mouth than to swallow it into the digestive system. You have to have negative pressure in the room so all the vapors are sucked away. So you don't breathe the mercury vapors. There are dentists who specialize in it, and it's very important to use modified citrospectin at high dosages before, during, and after, because it will bind to mercury. We showed it. And also, ideally, if you work with a naturopathic physician, with an holistic physician, get a high dosage vitamin C IV right away afterwards, 25 to 50 grams. Vitamin C, especially intravenously, is a very powerful chelator of mercury. So this is a little bit of an overview with some details about the importance of dental health, the connection between dental health and other issues. And there are so many. For example, many patients with adrenal weakness and fatigue, I always check if they had any traumas in the front teeth, because the front teeth relate to the adrenal. And if they do, by addressing it, either by injecting ozone or treating it with trays, or sometimes removing the tooth, if it's a dead tooth, you see dramatic improvement in the patient.